Acupuncture and dry needling are terms sometimes used interchangeably, and most people are uncertain as to what these terms mean or how they can help. Most people, including healthcare providers in America, don't fully understand acupuncture. So, to know the facts, this discussion is best had when the definition of acupuncture is fully understood. To begin with, there are dozens of types, kinds, and styles of acupuncture, such as Korean hand therapy. This system involves tiny needles used in the hands or fingers. Here is where the whole body is mapped out. Scalp acupuncture. Points are located all over the scalp. Many stimulate the brain. Five element. This style has points located all over the body. It is particularly effective for emotional distress. Auricular acupuncture. The whole body is mapped out on the ear. It is used often for stress, PTSD, addiction, organ disease. Japanese acupuncture. It's often gentle, points are located all over the body. Under the Japanese style, there are different types from here, such as samurai. TCM. This is the most common you will find in America. Points are located from head to toe. Like Japanese acupuncture and TCM, there are several styles and types of practice. Orthopedic trigger point acupuncture that addresses musculoskeletal issues. This style directly treats injury to muscles, tendons, joints, or ligaments, and occasionally even bone. We have now been illuminated to even just a few of the many kinds of acupuncture styles. Some of the points are located on meridians, some are off meridians. Some are located in joints, muscles, between muscles, on the face. The needles themselves can be as short as half an inch or as long as 6 to 8 inches. They may be thin or thick. They are all small, solid, filiform needles and flexible and, yes, dry. The term dry needling is in contrast to the hollow, stiff, hypodermic needles used for shots or blood draws. All of these acupuncture needles are what dry needlers are using. Nearly all styles of acupuncture share roots in one of the oldest medical texts in the world called the Neijing. The Neijing is over 2,000 years old. A dense book, it covered nearly every disease known to humans, in addition to treatments including acupuncture techniques. Some of these included the method called Fensi, which is puncturing and repuncturing where the pain is, such as a trigger point or a joint. Guanzi was another method that involved needling ligaments and tendons around the joint. Huizi is when the needler aims to get the sensation in the joint, and then the patient would move. Some needles are left in for hours or minutes or seconds. Some patients may need therapy daily, weekly, or monthly. These facts demonstrate just how much acupuncture revolves around individual patient care and how comprehensively it connects the nervous systems, blood vessels, organs, fascial planes, muscles, and the psychosomatic connections. Conditions from stroke, PTSD, ortho injuries, stress, pain may all be addressed by acupuncture medicine. Next, we discover that points are often named after their location and treatment function. For example, Jianjian is located on the small intestine meridian. Its translation to English is true shoulder. It is anatomically located on the shoulder, just below the posterior border of your deltoid muscle. Dry needlers like to use Jianjian, and acupuncturists have used it for centuries. It treats frozen shoulder, shoulder pain, scapular pain, and increases range of motion. So what is the difference between acupuncture and dry needling? Dry needling is a form of acupuncture. The same needles are used, the same ailments are treated, and the same techniques are implemented. The only difference is language. If the provider calls it jianjian or the teres minor muscle, is the provider doing anything different? So, know who is needling you. Here we see the difference between doctorates in each profession post-undergraduate degrees. Acupuncturists have a full 1 to 2 years on chiropractors and nearly double that of physical therapists, for a total of 9 to 10 years of education. Core education also includes biomedical, such as anatomy, physiology, pathology, psychology, and pharmacology. This knowledge is also required for board certification. Some acupuncturists go on to specialize and work side by side with doctors for things like infertility, pain management, cardiac health, or mental health. Acupuncturists commit to over 1,000 more hours of needle and acupuncture studies than that of any other profession studying the medicine. What this means is that very few people understand acupuncture, including dry needlers. In most of America, there are likely over 10 providers, such as physical therapists or chiropractors, to every one acupuncturist. This presents a problem in getting the facts out about acupuncture. Additionally, not every acupuncturist is trained in all the different styles and lineages of acupuncture, such as orthopedic, which is in high demand. So seek out your state acupuncture organization for certified acupuncturists. The NCC AOM nationally certifies acupuncturists and also provides a list. Health CMI is an excellent resource on the latest science and research.